Go.
You are dispatched to a residential construction site for a 32-year-old male who fell approximately 15 feet off of a ladder.
Okay. I'm gonna put my PPE on. Is my scene safe when I get there?
Yes.
Alrighty. Is this my only patient?
Yes.
And then my mechanism of injury was just the 15-foot fall. Is there anything else?
He landed on his left side.
Okay, landed on his left side. Alright, I'm gonna call for ALS, and I'm also gonna take C-spine precautions because he fell, so I'm gonna put him in a C-collar. Alright, when I walk up, what do I see with my patient? How is he lying? What's he doing?
You see an adult male lying on the ground, alert but grimacing in pain.
Alright. Hello, sir. My name is Max. I'll be your EMT today. Can you tell me why you called 911? Is he able to, respond to me and everything?
Yeah. He is alert and oriented. He responds appropriately, and he tells you that he fell off a ladder and that his ribs and leg hurt.
Your ribs and leg hurt. Alrighty. I'm gonna do my ABCs real quick. So I'm gonna look in your mouth. Is it patent? Is it stable? Is he gonna be able to keep it open on his own?
Yes, the patient is talking and the airway is patent.
Alright, so I'm gonna skip over an oral or a nasal adjunct. He doesn't need them. Breathing. Do I see equal bilateral chest rise?
His breathing is shallow, slightly labored, with diminished lung sounds on the left side, but clear lung sounds on the right side.
Okay. And then circulation. Do I see any bleeding right off the bat?
No major bleeding is seen.
All right, perfect. I'm gonna take his radial pulse real quick. What do I get for that?
112.
112. Alrighty. And then what is his skin condition?
His skin condition is pale, cool, and clammy.
Pale, cool, and clammy. Alright, I'm going to put him on a non-rebreather of 15 liters of oxygen, and then I'm going to wrap him in a blanket and lay him supine. And then we are going to immediately transport. I'm going to do a quick head to toe, make sure that I don't feel any breaks or see any major bleeding. Do I see any major bleeding or feel any abnormalities?
There is with his left thigh, it is very swollen, bruised, and you can feel a deformity in it.
Alright, we are going to put him in a traction splint on his left leg then, and then we are going to put him on a backboard, and then we are going to load and go. I'm going to have my partner get a quick set of baseline vitals, so blood pressure, SpO2, heart rate, and respiratory rate. Can I get those?
His blood pressure is 98/60. His respiratory rate is 22. His SpO2 is 93. And since you put him on oxygen, his SpO2 is now 95.
Alright. Alright, so I'm going to go through a quick history with you. So you said you have the leg pain, so we put you in a splint, and then rib pain. Is there anything anywhere else that you notice?
No, that's all that hurts.
Alright, just that. Are you allergic to anything? Any medications, any animals, any food?
No, I have no allergies.
Alright, are you on medications?
Occasionally I take ibuprofen.
Alright, do you have any past medical history that I should know about? Any diagnoses or surgeries or anything?
Nope.
Okay. What was the last time you ate or drank anything?
I had coffee and a breakfast sandwich about 2 hours ago.
Alright, and then I guess what were the events leading up to this? Like, how did you end up falling?
I was climbing down the ladder and slipped. I lost my balance and fell, landing on my left side.
Okay. Alright, so left side. Alright, I'm going to do my secondary assessment, so I'm going to start at the head. Do I feel any crepitus or bruising or swelling, burns, lacerations on the head?
Nope.
Alright. When I shine a light into his eyes, are they equal and reactive to the light and round?
Yes.
Right. Do I have any liquid coming out of the eyes, ears, nose, or mouth?
No.
Alright. I'm going to move on to the neck. I'm going to feel around. Do I see any jugular vein distension or tracheal deviation?
Nope, neither.
Alrighty. I'm going to move to the chest. You said it was the left side. I'm gonna actually look at his chest. Do I see anything there? Like, is there anything that's obviously like visible to my eyes?
No, there's no crepitus or flail segment noticed.
All right. Do I see any bruising or anything?
No, but it is tender.
Okay. And then on the rest of the chest, on his right side, is there anything that I need to worry about that I can see?
No, just the diminished lung sounds on the left.
All right, diminished lung sounds. All right, and then I'm gonna move on to my abdomen. I'm gonna palpate. Do I feel anything in the abdomen?
There is a tenderness in the left upper quadrant on palpation.
Okay. Is my pelvis stable? Do I feel anything out of socket or not where it's supposed to be, or any crepitus?
Nope, his pelvis is completely stable.
Right. And then is there a priapism?
No.
Alrighty. I'm gonna move on to the legs. The right leg is an attraction splint. What is my CMS for the right leg?
It is reduced in the right.
Reduced in the right, right? And then I'm gonna go down my left leg. Do I feel anything out of place? Anything wrong? And how's my CMS in my right leg as well?
Everything in the left leg is totally normal.
All right, and then I'm gonna go to the arms real quick. Do I feel anything on the right arm that shouldn't be there?
No.
All right, and then the left arm, when I feel around, how does that feel?
The left shoulder is tender on palpation, but no deformities or swelling.
Alrighty. And then I'm gonna move him, I'm gonna kind of log roll him onto his right side to check his back and buttocks. When I do that and I palpate the spine, do I feel any crepitus, anything out of socket, anything
No,
wrong?
the back looks perfectly fine.
And what about the buttocks?
Nope, nothing.
Alright, so I'll lay him back down. So I'm gonna assume that there's some obvious trauma in the pulmonary area. So we're gonna reassess every 5 minutes. Still treating for shock and everything. And we're gonna go to the nearest trauma center as fast as possible.